Hi everyone, this is Dr. Radhalakshmi Senthil, Senior Consultant Paediatrician at Lotus Speciality Clinic. Over the last few months, we've been doing a lot of educational, health informative talk to all of you. Today, I would like to share or even give an alert of possible accidental injuries in children. Children less than 5 years are at high risk for accidental injuries. Majority of these injuries are preventable, therefore you can prevent the sufferings which is related to these injuries. Some of these injuries can also lead to death. So let us just have a look at what are all the possible injuries and how you may take care of your children. Moment your child starts being mobile, so let us say your infant starts crawling after the month of 9 months, that is the time they are going to be mobile. From then on, they are going to be more and more active and they are going to crawl, they are going to walk, they are going to jump up and down. So you got to be very vigilant with these children. So what do you have to do? What do you have to expect with these children? Remember, children do not have understanding of danger sense. So we as adults must take a lot of precautions. To take these precautions, you should know what to look for. Children are very prone for falling from heights. Lot of time, parents come to us falling from cot. These are fine. Many a times we've also seen children falling from the first floor balcony, and some of the children roll down from the first floor staircases. Remember, walker is very unsafe in children. They start being more mobile with these walkers and accidents are very high with the walkers. So rather than falling simply on their own, when they fall with an object with them, the injury is going to be more dramatic on these children. So please avoid walkers in young children and please be very safe with regards to heights with the young children. Wherever possible, you put a safety lock to restrict the children's entry towards a balcony or even to the staircases. The next most dangerous injury which I would like to alert all of you is to the electrical sockets, electrical cables and electrical appliances. Young children tend to play with the electrical sockets. Remember, there is a constant discharge of electricity in those sockets and there can be even death secondary to electrocution. So, when a children is playing with any steel objects, playing with the sockets, remember to make sure that these sockets are closed and these children are very closely supervised and keep them away from all these electrical appliances. We've also seen children pulling the TV cables. Those loose cables, when the children are very mobile on crawling or walking, when they're not aware what they're doing, they tend to pull these cables from the TV. As a result, there is a lot of time these TV can fall on the children's head and lead to head injury and a long-term disability in these children. Despite all safety measures, we all know burns injuries are very common in every household. So keep this in your mind. When you're working in the kitchen, have a safety lock to the kitchen so that your child does not enter into the kitchen. And especially when you make a hot coffee or tea, keep the child away from your hot coffee or tea. Do not keep your child on the lap while you have your drink. There are high chances that they can spill onto the children and cause burns injury in your young children. Many a time, when the children are given a bath, the parents or the caretakers should check the temperature of the water before giving them a bath. There are good chances that the water they're giving a bath may be very, very hot and lead to burns injury in young children. Apart from this, remember to keep sharp objects such as knife, broken glass away from these children. It is very easy to hurt them and end up with a lot of bleeding in them. Also, whenever you store any of your chemicals, detergents or your medications, make sure those containers have a child-resistant top or a lock. In such a way, the child is not able to open them or accidentally ingest any of this as a poison. And poison injuries are significant in number in young children less than 5 years of age. Last but not the least is drowning. Remember, never leave your child unattended in a bathtub or in a paddling pool or in a swimming pool. Even if the water level is very shallow, child can drown. So majority of these accidents are preventable. If you had a good supervision and adequate support in taking care of these children, these accidents could be prevented. I hope this talk was highly informative. If you like the content, please like, share and subscribe to our channel. Thank you.